Have you ever gone to bed feeling fine, only to wake up dizzy, foggy, or worse, with no idea what went wrong? You drank some water, took your meds, turned off the lights, nothing unusual. But what if I told you that something in your bedtime routine, something you do every night, could be quietly increasing your risk of stroke? And you wouldn't even know it. According to the CDC, tens of thousands of older adults suffer nighttime strokes each year. It's not just about age, it's about small, preventable habits, things we've done for years without question, that can quietly put pressure on the heart, disrupt brain oxygen, or trigger sudden blood pressure swings in the middle of the night. But here's the good news. A few simple changes, just one or two, can make a powerful difference. Better circulation, deeper rest, and a lower risk of stroke, starting tonight. This video is inspired by research from the Mayo Clinic, Harvard, and real patient case studies. And it's here to help you sleep not just longer, but safer. In the next few minutes, I'll walk you through 7 hidden bedtime mistakes that raise your stroke risk, and exactly what to do instead. If you're over 60 and want to protect your sleep, your brain, and your heart, hit subscribe and let's begin. Because the first mistake, it's something almost everyone does, and it starts with water. So 1, drinking too much water before bed. You've heard it 1,000 times. Stay hydrated. And it's true. As we age, our bodies depend on water to keep our organs working, our joints moving, and our minds sharp. But what no one tells you is this. Drinking too much water before bed could quietly put you at serious risk. It sounds harmless, even healthy. A warm glass of water or herbal tea before turning in for the night. But as we get older, our kidneys slow down. Our bladders become more sensitive, and our body's ability to regulate fluid, especially at night, becomes less reliable. That means what goes in late often comes out in the middle of the night. Waking up once or twice to use the bathroom might not seem like a big deal. But here's the danger. When you rise from bed in the dark, half asleep, your blood pressure can drop suddenly, a condition known as postural hypotension. This makes you feel dizzy, unstable, or even causes you to faint. Combine that with weaker balance and slower reflexes, and a quick trip to the toilet can become a life-altering fall. In fact, the CDC reports that falls are the #1 reason seniors end up in the hospital, and many of them happen during nighttime bathroom visits. It happened to Ellen, 74, from Arizona. She'd always enjoyed a big mug of chamomile tea at night. It helped her wind down. But one night, she fainted on the way to the bathroom and fractured her hip. Her recovery was long and painful. Her doctor never told her to stop drinking tea, just to enjoy it earlier. Now she finishes her last drink by 7 p.m., and she hasn't had a fall since. And it's not just the risk of falling. Repeatedly waking through the night disrupts deep sleep, the kind your brain and heart need most. Poor sleep increases inflammation, blood pressure, and stress hormones. It even raises the risk of stroke. For anyone already living with high blood pressure, heart disease, or diabetes, those late-night wake-ups become more than an inconvenience. They become dangerous. The solution? Keep drinking water. Just shift the timing. Front-load your fluids in the first half of the day. After dinner, start cutting back. And at least 2 hours before bed, press pause completely. If you're still thirsty, take small sips, not a full glass. And avoid bladder irritants like black tea, coffee, or citrus juice in the evening. It's a simple shift, but it could protect your brain, your heart, and your independence. If you've ever felt groggy, lightheaded, or off balance in the night, your body might be sending a quiet warning. Listen to it. Because up next, we're talking about another innocent habit that could be quietly pushing your heart to its limits. That late-night snack. 2 late-night meals or salty snacks. The comfort that quietly strains your heart. We all do it from time to time. You finish dinner early, the evening winds down, and that little voice whispers, just a quick snack before bed. Maybe it's a cookie, a slice of toast, a salty cracker, something small, comforting. But here's the problem. That late-night bite could be silently putting pressure on your heart and increasing your risk of stroke while you sleep. As we age, our metabolism slows down. Digestion takes longer, and our body doesn't handle sugar, fat, or sodium the way it used to. So when you eat late, especially within 2 to 3 hours of bedtime, your system has to keep working through the night when it's supposed to be resting and repairing. Instead of entering deep, healing sleep, your body is busy processing food, and that can trigger more than just indigestion. One of the most common and dangerous outcomes is acid reflux. When you lie down with a full stomach, stomach acid can travel upward into the esophagus, causing that familiar burning feeling in the chest. But for older adults, the risks go further. Chronic nighttime reflux can lead to inflammation of the esophagus, aspiration of acid into the lungs, and even long-term damage that raises the risk of pneumonia or esophageal cancer. There's more. Salty foods eaten late, like chips, canned soups, or cheese, can cause fluid retention. That makes your heart work harder overnight and can keep your blood pressure elevated when it's supposed to dip. In fact, doctors call this your nocturnal dip, a natural lowering of blood pressure during deep sleep that protects the brain and heart. When it doesn't happen, stroke risk rises significantly. The American Journal of Hypertension has reported that seniors who consistently eat late have higher nighttime blood pressure and greater risk of cardiovascular events during sleep. And don't forget sugar. Late-night sweets spike blood glucose at a time when your body is most vulnerable. If you're living with pre-diabetes or type 2 diabetes, this can lead to unpredictable insulin responses and rob you of the deep sleep your brain needs to clear toxins and form memory. The solution? Keep dinners light and early. Ideally, finish eating at least 3 hours before bed. Avoid heavy, greasy, or salty meals. Instead, choose foods that support restful sleep and stable blood sugar, like a small handful of unsalted almonds, half a banana, or a spoonful of plain yogurt if you truly need something. These are gentle on your digestion and won't throw your body into metabolic overdrive. It might feel like a small sacrifice, skipping that snack, but it's really a gift to your heart, your brain, and your long-term energy. Because when your body gets a chance to fully rest, it doesn't just recover, it heals. And next we'll talk about another factor that seems cozy and harmless, but could actually be overheating your body and overworking your heart. Let's talk about your bedroom temperature. 3. Sleeping in a hot room. The cozy habit that could strain your heart while you sleep. There's something comforting about a warm bedroom, especially as we get older. Maybe you turn up the heat, add an extra blanket, or shut all the windows to keep the chill out. It feels cozy, safe, familiar. But here's the truth most people don't know. Sleeping in a room that's too warm can quietly put your heart under pressure and increase your risk of stroke overnight. Your body is designed to cool down as you fall asleep. This drop in core temperature is what helps trigger deep, restorative rest, the kind that supports memory, immune health, and blood pressure regulation. But when your bedroom is too hot, usually above 67 degrees or 19 degrees, your body struggles to release that heat. And instead of resting, it starts working harder to cool itself down. That internal effort isn't just uncomfortable, it's stressful. Studies from the American Journal of Geriatric Psychiatry show that older adults sleeping in warmer environments get up to 30% less deep sleep than those in cooler rooms. That means less time for your brain to clear toxins, for your immune system to reset, and for your blood pressure to dip naturally, all of which are critical to preventing cardiovascular issues like stroke and heart disease. But the risks don't stop there. Overheating during the night can lead to silent dehydration, especially in older adults who may not feel thirsty. Sweating while you sleep causes your body to lose fluid and electrolytes, and without realizing it, your blood can thicken. Thicker blood puts more strain on your heart and raises the risk of blood clots. And for seniors with high blood pressure, heart failure, or arrhythmia, this hidden stress can be dangerous. So how do you fix it? You don't need to freeze, just cool things down a bit. Keep your bedroom between 60 and 67 degrees Fahrenheit, 15 to 19 degrees. Use lightweight, breathable bedding. Think cotton sheets instead of heavy quilts. Layer your blankets so you can easily adjust during the night. If the room still feels stuffy, crack a window or use a quiet fan to keep air circulating. These simple changes can make a massive difference, not just in comfort, but in health. When your body rests at the right temperature, your heart beats easier, your brain detoxes better, and your risk of overnight emergencies goes down. Have you ever noticed that you sleep better in a cool room? Or do you tend to pile on the blankets and wake up groggy or sweating? Let me know in the comments. I'd love to hear what works best for you. You might even help someone else figure out what's been disrupting their sleep. Because next, we're moving from room temperature to something even more personal. What happens when you jump out of bed too fast? It might feel harmless, but the risk is real. Let's talk about it. 4. Taking the wrong medication at night. The pill that may be sabotaging your sleep and raising stroke. Risk. For many seniors, nighttime medications are just part of the routine. You brush your teeth, turn off the lights, and take a pill or two before bed. Maybe it's something for your blood pressure, a muscle relaxer, or a sleeping aid. But here's the problem. Taking the wrong medication at the wrong time can quietly disrupt your body's natural rhythm, interfere with your heart, and increase your stroke risk overnight. As we age, our bodies metabolize medications differently. What used to pass through your system quickly can now linger, accumulate, or react in unexpected ways. Certain pills, especially sedatives, sleeping tablets, and some blood pressure medications, can cause overnight hypotension. That means your blood pressure drops too low while you're asleep, reducing blood flow to your brain. And when the brain doesn't get enough oxygen, the risk of stroke rises. It gets even more dangerous when these medications are combined. Many older adults are on multiple prescriptions, a blood thinner here, a beta blocker there, maybe something for anxiety or pain. Taken together at night, they can slow breathing, weaken circulation, and increase confusion if you need to wake suddenly. That groggy, off-balance feeling you sometimes get in the morning, it's not just aging, it could be a medication overload. Let's take Diane, 77, from Ontario. She used to take her blood pressure meds, a pain reliever, and a sleep aid all at once before bed. For weeks, she felt foggy in the morning, and one night she woke up and fainted in the bathroom. After speaking with her doctor and adjusting the timing of her medications, her sleep became deeper, and the dizziness disappeared. The science backs it up. A study published in Hypertension found that timing matters. For some people, taking blood pressure meds at night can improve control. But for others, especially those with low nighttime pressure or heart rhythm issues, it can do more harm than good. That's why personalization is key. There's no one-size-fits-all. So what can you do tonight? First, never start, stop, or reschedule your medications without talking to your doctor. Ask whether your current nighttime medications are truly necessary at that hour, and if safer alternatives exist. In many cases, non-sedating solutions like gentle stretching, chamomile tea, or breathing exercises may help more than a pill ever could. And if you've ever woken up feeling off, dizzy, or just not yourself, it might be time to rethink your routine. Your brain and your heart need the right kind of rest. Not the kind that's chemically forced, but the kind that comes from balance and safety. If you've ever had a weird reaction to a nighttime pill, or just felt foggy and couldn't explain why, drop the word foggy in the comments. You're not alone, and your story might help someone else realize it's not just them. Up next, we'll move into a topic most people never think about: your sleep position. It might feel harmless, but it could be cutting off oxygen to your brain every single night. Let's take a closer look. 5. Sleeping on your back. the position that may quietly steal oxygen from your brain. Everyone has a favorite sleeping position. Some curl up on their side, others stretch out like a starfish. But for millions of older adults, one common position, sleeping flat on your back, could be silently increasing their risk of stroke night after night without them even realizing it. Here's why. When you lie flat on your back, gravity naturally pulls the tongue and soft tissues in your throat downward. This narrows your airway and can restrict airflow, especially if you already snore or experience undiagnosed sleep apnea. Less airflow means less oxygen. And when oxygen to the brain drops repeatedly during the night, it creates stress on the cardiovascular system and increases inflammation, blood pressure spikes, and ultimately stroke risk. Even without a formal sleep apnea diagnosis, back sleeping can reduce oxygen saturation by up to 40% compared to side sleeping. That's not just uncomfortable, it's dangerous. The Journal of Clinical Sleep Medicine found that seniors who sleep on their backs have a 22% higher chance of experiencing cardiac events during sleep than those who sleep on their side. But it's not just about breathing. Back sleeping can also worsen acid reflux, making it easier for stomach acid to rise into the throat, especially after a late meal. That acid can cause silent damage, contribute to aspiration pneumonia, and make restful sleep nearly impossible. And then there's your brain. A study from Stony Brook University found that side sleeping, particularly on the left side, helps the brain's glymphatic system clear out waste products more efficiently, including beta amyloid, a protein linked to Alzheimer's. Back sleeping reduces this clearance, meaning toxins may build up faster over time. So what's the better choice? Experts agree. Sleeping on your left side is ideal. It supports better circulation, eases pressure on the heart, helps digestion, and improves brain detox overnight. It may feel unfamiliar at first, but there are simple ways to retrain your body. Place a firm pillow behind your back to prevent rolling over. Tuck a small pillow between your knees to keep your hips aligned, and use a contoured neck pillow to support proper spinal posture. If you suffer from reflux, elevating the head of your bed just a few inches can also make a big difference. Over time, these small adjustments can become second nature and lead to more restorative, safer sleep. So, how do you usually sleep? Are you a back sleeper or have you already made the switch? Type the word side in the comments if you're committed to sleeping smarter tonight. You might inspire someone else to rethink their position too. Next, we'll look at a bedtime mistake that feels good in the moment, but could be secretly overworking your heart and robbing you of critical sleep. Sleeping in a hot room. Stay tuned. 6. Ignoring snoring or sleep. Apnea. Signs. The sound that could be silently strangling your sleep. We often laugh about snoring, whether it's a partner rattling the walls or waking ourselves up with a loud gasp. But for seniors, snoring is no joke. In fact, it could be the most dangerous sound in your bedroom. Snoring isn't just annoying. It can be a warning sign, one your body whispers night after night, that something far more serious is going on. Obstructive sleep apnea. This condition happens when your airway temporarily collapses while you sleep, cutting off oxygen for seconds or even minutes at a time. And each time it happens, your brain panics, your heart races, and your blood pressure spikes. Over the course of one night, this cycle can repeat dozens or even hundreds of times, placing intense strain on your heart, brain, and blood vessels. You might not even remember it, but your body does. Studies show that untreated sleep apnea increases your risk of stroke by up to 60% and raises your chances of having a fatal heart attack by nearly a third. And here's what's even more alarming. Nearly 80% of older adults with sleep apnea go undiagnosed because they think snoring is just part of getting older. But sleep apnea doesn't just harm your heart. It starves your brain of the deep rest it needs to clear toxins and repair itself. Seniors with untreated sleep apnea are more likely to experience memory loss, brain fog, and cognitive decline. In fact, research suggests that chronic sleep deprivation may accelerate dementia-related changes 3 times faster than normal aging. So, how do you know if this silent danger is affecting you? Often, a partner or caregiver notices first. Warning signs include loud snoring, gasping for air during sleep, pauses in breathing, or waking up tired despite a full night in bed. Morning headaches, dry mouth, or trouble focusing during the day are also red flags. If any of this sounds familiar, it's time to take action. Speak with your doctor or a sleep specialist. A simple overnight sleep study can provide answers. And if sleep apnea is diagnosed, treatments like CPAP machines, positional therapy, or lifestyle changes can drastically reduce your risk and dramatically improve your sleep quality. Remember, this isn't about vanity or convenience. It's about protecting your brain, your heart, and your future. Rest is not a luxury. It's a necessity for healing, for clarity, for life. If you or someone you love has struggled with snoring or sleep apnea, comment the word "breathe" below. Your voice might give someone else the courage to get checked too. Coming up next, we'll talk about one final bedtime danger that feels completely harmless, but could be silently raising your blood pressure, interrupting your sleep, and adding extra strain to your entire system. Let's talk about the simple act of getting out of bed too quickly. 7. Jumping out of bed too fast, the innocent habit that could trigger a dangerous fall or stroke. It sounds so simple. You wake up in the middle of the night, swing your legs over the side of the bed, and stand up. Maybe you're heading to the bathroom, grabbing a glass of water, or just stretching your legs. But for seniors, this everyday habit, getting out of bed too quickly, can become a silent trigger for some of the most serious medical emergencies. Why? It all comes down to blood flow. As we age, our circulatory system becomes slower to adapt to sudden changes in posture. When you move from lying down to standing up, your blood pressure drops, sometimes drastically. This is called orthostatic hypotension, and it can lead to dizziness, blurred vision, or even a brief loss of consciousness. It doesn't just feel uncomfortable, it can be dangerous. The early morning hours are particularly risky. That's when your blood pressure tends to be naturally lower, your body is slightly dehydrated, and your muscles are still stiff from sleep. One wrong step, in the dark, groggy, and unsteady, can lead to a fall. And for older adults, a fall isn't just a bruise. It's broken hips, concussions, emergency surgeries, and sadly, the loss of independence. The JAMA Internal Medicine Journal has shown that seniors with postural hypotension are at significantly higher risk for hospitalization, fractures, and even stroke. And many of these episodes happen during routine movements, like standing up too fast after resting. But there's good news. This is one of the easiest habits to change, and the benefits are immediate. Start by taking your time. When you wake up, don't rush. Sit upright on the edge of your bed for 30 to 60 seconds. Wiggle your toes. Flex your ankles. Take a few deep breaths. Let your circulation catch up before you stand. If you're especially prone to dizziness, keep a small bottle of water by your bed and sip it slowly before rising. Lighting also matters. Install motion-activated night lights to gently guide your path. Wear non-slip slippers. Clear clutter from walkways, and if you need extra stability, consider a bedside rail or holding onto a dresser or wall. These small shifts can prevent big problems. They don't cost much and they don't take long, but they give your brain the oxygen it needs and your body the balance it deserves, right from the very first moment of your day. Have you ever stood up too quickly and felt your head spin? If so, type the word "slow" in the comments. Not just as a reminder for yourself, but as a gentle nudge for someone else who might need it too. Because now, more than ever, the way you start your day can shape the quality of your life. And with that, let's bring it all together. A powerful reminder that small bedtime habits aren't so small after all. Stay with me. Let's take a moment to look back. Tonight you learned that something as simple as a glass of water, a salty snack, or sleeping on your back can quietly strain your body in ways most people never realize. You discovered how a warm bedroom, rushing out of bed, or ignoring your snoring can silently increase your risk of stroke, not because your body is failing you, but because no one ever told you how sensitive the body becomes after 60. But now you know. You know that your brain, your heart, and your entire nervous system still want to protect you. They just need a little support. And the beauty is, these aren't massive lifestyle overhauls. They're gentle changes. A little less fluid at night, a cooler room, a slower start to your day. These are changes you can make tonight, right now. So if you've ever felt foggy in the morning, or woken up gasping, or stood too fast and lost your balance, I want you to hear this clearly. You are not fragile. You are wise. And wisdom means listening when the body whispers, not waiting for it to scream. This video wasn't made to scare you. It was made to empower you, to remind you that you still have control. You can change your habits. You can lower your risk. You can protect your sleep, your brain, and your independence. And you don't have to do it alone. If this video gave you clarity or hope, type strong in the comments to let me know you're walking this journey with me. And if you know someone who snores, who sleeps hot, or who pops a sleeping pill every night, share this with them. You might just save a life. Don't forget to subscribe because the next video could be the one that changes everything for your heart, your energy, or your memory. You're not past your prime. You're entering a new chapter, one that starts with awareness and leads to strength. Take care tonight, sleep wisely, and I'll see you in the next video.